Good morning. I'm Daphne James. I'll be talking to you today about the state of the profession, workforce demands for nuclear medicine technologists. The presentation will explore the factors that contribute to workforce supply and demand of nuclear medicine technologists in Australia over the past 5 to 10 years. I'll be using some data from AHPRA, from the registrations, Medicare Australia statistics, and the labour market information around job advertisements. I'll review the trends and discuss some potential solutions. The global nuclear medicine market has experienced rapid growth over the past decade. Growth has been experienced increasing, and the compound average growth rate is around 9% for between 2021 to 2025 as a forecast. And it's expected that the total nuclear medicine market will be around 7.5 billion by 2026. And this is pushed largely because of new radiopharmaceutical developments and theranostic developments that are increasing. Growth in Australia is also occurring at a rapid rate, and we're seeing numerous new sites being developed, particularly in smaller areas, and new procedures, again, PET particularly, and the theranostics and other new radiopharmaceuticals. Medicare Australia records the data for services provided, and between 2010 and 21, we've seen a 72.6% increase in the total nuclear medicine services provided in Australia. So that's the yellow line on the graph, and you can see it's gone from almost 500,000 up to over 800,000 in that 10-year period. This has largely been driven through PET and CT. So the general nuclear medicine services have remained relatively steady at around 400,000 per annum, which is the blue line. And you can see there was actually a dip in 2021, which we can make assumptions around whether that's a COVID impact, but there's already a slight increase from onto 2021. So the main changes or the main increases have occurred in both PET and the number of CT services provided with nuclear medicine services. So PET has increased since 2018 by almost 50%. That's the grey line. Prior to 2016, Medicare did not have benefits, so there's no recordings. The orange line is the number of CT, item number 61505, that's been performed. And there's been a 230% increase in those services since 2010. And we know that pretty much all new cameras, whether they're SPECT or PET, are now hybrid SPECT CT, PET CT, and the majority of our patients are having a CT alongside of their nuclear medicine procedure. So this is an enormous increase in the number of procedures being performed by the nuclear medicine staff, and in particular the nuclear medicine technologists over that period of time. In contrast to the 70% increase in services, the AHPRA registration data only shows around a 12% increase in the number of registered nuclear medicine technologists in the past 5 years. You can see from the graph on the left, which has both nuclear medicine, radiation therapists and radiographers shown, that the blue line is relatively stable, whereas the graph on the right shows a little bit more detail that there has actually been an increase. So the workload has substantially increased in this time, especially in PET, but the number of people performing that workload has not. And this increased workload has the potential to lead to increased radiation exposure, particularly for people working in PET. But it can also lead to emotional burnout and increased levels in decreased levels in job satisfaction and workforce retention. So we need to be really mindful that the workforce that we have is under a lot more stress and an increased workload to perform the duties that they are required to do. These graphs show on the left the total registration, so it's all divisions, radiography, nuclear medicine and radiation therapy, for provisional and non-practicing. So the blue is provisional, which were the PDY positions, and the orange is non-practicing. And this is sort of in line with the changes that have been made to medical radiation programs across Australia, where most of them are now 4 years. There's been a significant decrease in the number of provisional registrations in that time, from 652 in 2016 down to only 58 in 2021, and we'd expect that to be decreasing now, as there are no more programs in medical radiation that require a supervised practice period. The graph on the right shows the nuclear medicine technologists by age group, and really that hasn't changed very much over a period of years, except for the under 25s, and we seem to have less people under 25 in our profession, and that would probably indicate that we've got more people coming through our programs who are mature age or who have other qualifications prior to doing nuclear medicine. This data is from a source called Burning Glass Technologies, where you can look at the number of job advertisements recorded in Australia each month. So we've gone and looked at the past 5 years for all three medical radiation categories: radiographer, radiation therapist, nuclear medicine technologist. And you can see the radiographer line is actually on a trend decreasing. The number of jobs being advertised for them has considerably decreased. If we look back early in the graph in 2016, the peaks were around 150 jobs, and it's now down to around 50. The orange line is radiation therapy. It's actually on a slight increase, although it has had some quite high peaks. They're usually towards the end of the year, as we would expect with graduates coming out of their programs. And then the nuclear medicine line which is the grey line, looks relatively flat. And in fact, the number of advertisements have remained around about 70 to 80 per annum, and that's remained steady over the last 5 years. And I think sometimes it looks like we've got a lot more positions being advertised, but I think we're seeing those advertisements a lot more due to social media and circulations through groups like the New South Wales Society of Nuclear Medicine Scientists, the Victorian Society, and also through RAINS. University completions have actually decreased, and this is across the universities. So there's 4 programs in Australia: the University of Newcastle, University of South Australia, Charles Sturt Uni and RMIT in Melbourne. The dip on that, this is our Newcastle completions, and you can see a big dip in 2018, which is when we changed from a 3-year to a 4-year program. So there was a year where we had very few graduating students, but we're actually on a slight increase in the last 1 or 2 years. We really need to be promoting the profession more widely, especially in areas with no program. So Western Australia, Queensland, Tasmania, Northern Territory and the ACT, to try and get people from those areas into programs so that they can then supply the workforce for those states and territories. Clinical placements across Australia are a huge issue for all health programs, and that's partly due to the impact of COVID over the last few years, which is continuing, but it's also due to things like private sites actually requesting payment. It's due to increased costs for students, which is making it more difficult for the students to go to interstate, so transport costs, accommodation. There are some scholarships for students to go for nuclear medicine into WA and Queensland, but we really need more of those to encourage students to move and do their placements in those wider flung areas. Other issues are that some departments are unwilling to take our first or second year students. That's often because they're less experienced, they require more supervision and mentoring. We also have some departments, many new departments, which have not been identified by the universities as placement sites. So we'd really encourage you, if you're not getting students from our universities, to contact us and let us know so we can put you on our databases and actually start sending you students. Our requirements through the MRPBA mean that students have to complete a variety of experience through their program, and that's to do with the case mix, but also that they have exposure to rural, metropolitan, public and private sites. So we really do need to have a bigger database to allow the students to get those experience. And the bottom line is we need to train more graduates so that we can provide for the future workforce and that increasing global market, Australian market, and number of procedures. So in conclusion, there's been a huge increase in the nuclear medicine services over the last 5 years provided by our nuclear medicine staff, especially in PET and CT, and more recently, of course, in the theranostic area. There's only been a small increase in the number of registered nuclear medicine technologists to perform the increased workload. And this may lead to increases in radiation exposure and emotional burnout and decrease in the work satisfaction and retention of our staff in the profession. So we really do need to ensure appropriate placement opportunities to make sure we have quality work-ready graduates to provide for our workforce. Thank you.